Good morning, everyone. I am Dr. Balakrishna Solanki from Second Year Resident Pediatric Department, BJMC, Ahmedabad. My paper presentation is on clinical spectrum of patient of tuberculosis in a tertiary center intensive care unit. My aims and objective was to analyze the clinical profile of pediatric tuberculosis patients in intensive care unit. Materials and methods. It is a retrospective study was carried out in BJ Medical College, Civil Hospital, Ahmedabad. Patients from 1 month to 12 years of age admitted in PICU and diagnosed as a case of tuberculosis between Jan 2023 to December 2023 were included in this study. All children 1 month to 12 years of age diagnosed as a case of tuberculosis based on either microbiologically confirmed or clinically proven.
Jump to your results.
Total admitted patients in pediatric ICU were 2,431. Total 88 patients, which is 3.7%, met the inclusion criteria. And male-female ratio was 1.4:1. And age distribution, as you can see on the chart. Number of patients diagnosed with different types of tuberculosis is percentage-wise is on the slide. Correlation between age group and type of tuberculosis. Neurotuberculosis, which was found more common in age group 1 month to 5 years. Disseminated tuberculosis, which was found more common in 5 years to 10 years of age group. And pulmonary TB, which was most commonly found in 10 years to 12 years of age group. 86% patients were in lower socioeconomic class according to modified Kupuswamy classification. 65 patients were immunized and 23 patients were unimmunized, in which disseminated TB was more common, followed by neuro TB. History of COX contact present in 16 patients, among which 3 patients had taken isoniazid prophylaxis. Investigation: 21 patients were investigated and diagnosed by CBNAT, and 67 patients diagnosed radiologically. The most common indication for admission in PICU were monitoring and management of neurological status in 34 patients, followed by respiratory failure. The most common form of tuberculosis admitted to pediatric intensive care unit was neurotuberculosis. Total mortality of pediatric intensive care unit was 492, among which 26 patients, which is 5.2% patients, expired due to tuberculosis. Among 88 patients admitted for TB, 26 patients, which is 28%, expired. Among 30 patients of neurotuberculosis, 12, which is 40% patient, expired. The cause of mortality include tubercular meningitis, which is most common, 40%, followed by pneumonia, 25%, septic shock, 15%, and multi-organ dysfunction syndrome, 12%. Conclusion: extrapulmonary tuberculosis was more common in pediatric patient and more common in children under 5 years of age. Neurotuberculosis, 34%, was the commonest reason for admission in pediatric intensive care unit. 86% patients were from lower socioeconomic class and 63% were
It was positive in 5 odd and radiological diagnosis was 75%. Right? Do you mean to say that radiological diagnosis is the better tool to diagnose pediatric tuberculosis? Yes or no?
Yes, sir. In pediatric patients are which is most commonly possibacillary, so it is difficult to diagnose microbiologically.
So the sensitivity of CBNet is hardly 20%. Okay, done.